طبعا هذا في الموضوع هو مهم ايضا نستخدمه بال يعني نقول how to control the function of the disease like مثلا epilepsy. فنعرف الفانكشنال neurosurgery هي functional procedures aim to relieve epilepsy, movement disorders or pain by ablation or stimulation. يعني نسوي في الابليتيف بروسيجر للبرين ومن خلالها نسيطر على ممكن الابيليبسي، ممكن على الموفمنت ديسوردر or pain اللي هي either by stimulation or ablation. الابيليبسي up to 10% of population will suffer seizures at some point in their lives. And epilepsy, a syndrome of recurrent unprovoked seizures, represent the most common neurological disorders. About 20 to 30% of patients fail to achieve adequate seizure control with the drugs. And many of these focal epilepsies may benefit from surgery. يعني احنا الابيليبسي تعرفوه عندنا انتي ابيليبتيك دراج قسم منهم controlled والبعض قسم not well controlled. Where a primary lesion such as a tumor, arteriovenous malformation or cavernoma is present, legionectomy alone may be appropriate. قسم اللي عندهم يعني underlying cause للإبيليبسي like brain tumor or AVM or cavernoma, فليجينكتومي يعني removal of the lesion may be appropriate. In other cases, the clinical picture includes seizure type, focal features, and investigation results can be used to identify the seizur's focus. Dual pathology referred to the presence of an extra hippocampal lesion plus hippocampal atrophy. Important because removal of both lesion and the atrophic hippocampus is the best surgical approach and should be considered whenever possible. تعرفون بالديول باثولوجي معناها عندنا hippocampal atrophy وعندنا extra hippocampal lesion. For surgical approach, the best one is to remove both lesion. Investigation used in the management or surgical management of epilepsy. MRI اللي هو magnetic resonance imaging is a mainstay, demonstrating, for example, a reduced hippocampal volume and distorted architecture in the mesial temporal sclerosis. Nuclear medicine modalities مثل الSPECT and الPET اللي هي single photon emission computed tomography and the positron emission tomogram are sometimes used to demonstrate the ictal and the interictal metabolic abnormalities. EEG entails recording from an array of scalp electrode and comparison between ictal and interictal recordings, and it's helpful in lateralizing the focus of complex partial seizures in temporal lobe epilepsy. هاي أهم investigation in the diagnosis before surgical treatment اللي هي MRI, nuclear medicine, and the EEG. A more detailed localization may be achieved invasively by the preoperative placement of subdural or depth electrodes, preoperatively or by intraoperative electrocorticography. هاي أكثر localization نسويه invasively. Neuropsychiatric evaluation is used to evaluate the patient's preoperative function, looking for the concordant focal impairment, and using the WADA test, where the sodium amytal is injected into each internal carotid artery with simultaneous speech and memory testing to localize the function. هذا احنا نستخدم أيضا another method of localization which is called a WADA test by injecting the sodium amytal into each internal carotid artery with simultaneous speech and memory testing to localize the epilepsy focus. The aim is to establish language laterality and to confirm that the resection on the side of the lesion will not significantly impair verbal memory function. يعني راح نحدد من خلال الميموري اريا او اللانجوج اريا اللي هي مهمة after removal of the epileptic focus. Surgical management. The seizure focus may be resected, generally where it is in non-eloquent brain or otherwise a disconnection can be performed. يعني الريسكشن of the seizure focus اللي هو non-eloquent brain is very important, otherwise a disconnection can be performed. Awake craniotomy, allowing mapping particularly of speech centers, is increasingly employed. هنا يستخدمون wake craniotomy حتى من خلالها يصير mapping للاريا. Mesial temporal epilepsy is commonly medically refractory and can be addressed surgically by amygdalo-hypocampectomy or resection of temporal lobe including the mesial structure. الميزيال temporal epilepsy يقصد به الابيليبسي اللي هو يطلع من التمبرال لوب، هذا يكون refractory للدرج treatment and surgically removed by amygdalo-hypocampectomy or resection of temporal lobe including the mesial structure. The extent of resection is limited by the potential for damage to the optic tract and to speech area in the dominant hemisphere. وهنا نكون careful بالresection of such structure لأن عندنا structure القريب من عندنا هو optic tract and the speech area, especially in the dominant cerebral hemisphere. With careful patient selection, the cure rate may be reached up to 70% or greater can be achieved. يعني بهاي الطريقة ممكن نحصل على cure rate من الإبليبسي 70%. عندنا functional or rarely anatomical hemispherectomy may be performed for specific epilepsy syndrome associated with hemiplegia such as infantile hemiplegic syndrome. هنا الهيمسفيركتومي راح يعني معناها راح نشيل او نمنع الكونكشن between the two cerebral hemisphere, especially in epilepsy associated with hemiplegia والcondition اللي هي عندنا like infantile hemiplegia syndrome. Another surgery it called disconnection procedure include corpus callosectomy used for patients suffering drop attacks and sapile transection to isolate a seizure focus in eloquent brain from the surrounding cortex. نعزل epileptic focus surrounding region of the brain ونمنع electrical discharge by what is called corpus callosectomy. Vagal nerve stimulation موجودة عندنا هنا بالعراق يصحوا لها VNS vagal nerve stimulator are implanted in severe drug refractory epilepsy, usually in children, and can achieve some success in reducing the seizure frequency, although the mechanism isn't clear and is never curative. بالvagal nerve stimulation هنا بحالة الدرج refractory نستخدمها يعني كأدجوفنت ثيرابي للدرج، ما راح نعيف الدرج، ممكن نقلل الدوز of anti-epileptic drug but not achieve cure in the treatment of epilepsy. عندنا another topics for functional treatment هو movement disorders. Prior to the advent of levodopa, surgical ablation of subthalamic nucleus or globus pallidus interna was a mainstay in the management for the Parkinson's disease, achieved using a deep brain stimulation with electrode. This offers the advantage of an adjustable and reversible effect and can be performed bilaterally, where the equivalent lesioning surgery would likely result in deficit. Deep brain stimulation is also an option for other movement disorder where less invasive approach are ineffective. يعني deep brain stimulation أيضا important in the treatment of the movement disorder where less invasive approach are ineffective and include dystonia, which may be amenable to bilateral stimulation of the globus pallidus interna, and essential tremor where the ventral intermediate nucleus of the thalamus is the target. يعني نروح للتارجت ونسوي له stimulation. Pain syndrome, another disorder which is managed by ablative procedure, pain syndrome. The neurosurgical approach to the relief pain may address the underlying etiology directly or may seek to interrupt or modulate the transmission responsible for the pain. عندنا trigeminal neuralgia manifests generally in the middle age or later with paroxysmal lancinating pain in the distribution of one or more division of trigeminal nerve. The pain occurs without other neurological disturbance and may be triggered by trivial stimuli such as eating or brushing the teeth. The pain was first attributable to stimulation of the nerve by adjacent vascular structure of the superior cerebellar artery. يعني لقوا انه هذا البين because of the vascular malformation and compression of the trigeminal nucleus by the vessels اللي هو like superior cerebellar artery. Occasionally, another primary lesion is responsible, for example, bilateral trigeminal neuralgia in younger patients is suggestive of multiple sclerosis. يعني ممكن ال MS, it is one of the cause of trigeminal neuralgia, where medications such as gabapentin or carbamazepine cannot achieve control. So surgical options in trigeminal neuralgia include craniotomy and microvascular decompression. craniotomy يعني نسوي فتح جمجمة ونسوي microvascular decompression لأن قلنا قسم من trigeminal neuralgia either because of pressure from the adjacent vessel like cerebellar vessels فنسوي decompression, نسوي separation and remove the pressure from the vessel on the nerve. This microvascular decompression designed to address the proposed origin of the neuropathic pain by applying material between the nerve and the adjacent vessel to prevent direct contact and stimulation. Achieve long-lasting relief of symptoms in about 80% of patients, but is associated with the standard risk of craniotomy and significant incidence of cranial nerve deficit. Peripheral nerve injection, which can achieve good short-term relief of pain restricted to small areas supplied by trigeminal branch of the trigeminal nerve. Percutaneous Gazerian rhizolysis هذا شلون involve needle placement under the X-ray guidance at the Gazerian ganglia. تعرفون Gazerian ganglia يصير بالbase of the skull, one of the ganglia for trigeminal nerve in Meckel's cave, and this permit lesioning of the ganglia by glycerol injection. Radiofrequency thermocoagulation or balloon compression with the aim of disrupting apparent pain transmission. Similar effect can also be achieved using stereotactic radiosurgery. Facial numbness and late recurrence of pain are common after this procedure. يعني هاي البروسيجر المهمة to control the pain in case of trigeminal neuralgia. Treatment of pain elsewhere may also be based on lesioning of the nerve tract. For example, pain related to the brachial plexus infiltration or injury may be treated by sectioning the spinothalamic tract. يعني نسوي له spinothalamic responsible for pain sensation نسوي له what's called chordotomy or dorsal root entry zone operation. These approaches are limited by the potential for producing deficit and especially by the occurrence of deafferentation لأن هذا مرات يصير عندنا neurological deficit after the chordotomy or after dorsal root entry zone operation ويصحوا له phantom limb. The pain syndrome which are particularly unpleasant and difficult to treat يصير عندهم severe pain and difficult to treat. Electrical stimulation is used to modulate pain transmission. For example, spinal cord stimulator can be applied to a range of pain syndrome, especially those associated with failed spinal surgery. Those يصير عندهم failed back surgery, يصير عندهم severe pain, نسوي لهم electrical stimulation by applied the spinal cord stimulator. Deep brain stimulation targeting the periaqueductal gray and sensory thalamic nuclei has a role in chronic pain arising in the context of thalamic stroke. قسم من عندهم يصير pain بالCVA بالستروك نسوي له lesioning بالperiaqueductal gray and sensory thalamic nuclei. Implanted device may also be used for intrathecal delivery of opiate for pain control or baclofen to alleviate spasticity. هذا هنا نستخدم implantable device ممكن عن طريق intrathecal delivery of opiate or baclofen. In summary, intractable epilepsy can be treated surgically by implantation of a vagal nerve stimulator or by resection of one or more seizure foci. Deep brain stimulation using implanted electrode has largely replaced lesioning of this structure for management of drug refractory Parkinson disease. Microvascular decompression is offered for trigeminal neuralgia and the other neuropathic pain may respond to lesioning of the nerve tract. And thank you. ها طلاب وياي كلينيكين؟
اي دكتور وياك.
اي راح نبلش بالمحاضرة هسه الثانية، هذين محاضرتين قصيرة يعني اللي هي compressive neuropathy and practical and ethical issues in neurosurgery. نيجي على practical and ethical issues. نيجي على disease. It's called Creutzfeldt-Jakob disease. هذا سامعين به طبعا، هو موجود. Creutzfeldt-Jakob disease is a rare transmissible spongiform encephalopathy. سهولة يعني الدماغ يصير مثل السبنج، spongiform. It's a rare transmissible spongiform encephalopathy producing a rapidly progressive dementia, خرف, and is uniformly fatal. The causative agent seemed to be a misfolded protein, a prion. هذا البرايون هو responsible, which is not destroyed by the conventional sterilization technique. UK practice involved undertaking preoperative check to exclude any risk factor for Creutzfeldt-Jakob infection, and this include family history. يعني لقوا هذا السبونجي فورم البرين يصير على شكل سبونج because of some بروتين اللي وصفوا له البرايون. وباليونايتد كينجدوم عندهم في usual practice انه يسوون seeking preoperative check to exclude any risk factor, and this include family history. شنو الريسك فاكتور for Creutzfeldt-Jakob infection؟ recipient of pituitary derived human growth factor. إذا واحد ماخذ recipient يعني pituitary derived human growth factor. cadaveric dural matter graft. إذا واحد يحتاج cadaveric dural matter graft. and previous brain or spinal surgery prior to 1997 لأنه كانوا ما يعرفون هذا الديزيز وكانوا يستخدمون الجرافت أو يستخدمون الهيومن جروث هرمون from pituitary where the risk factor are present. Instrument must be quarantined or destroyed post-operatively. طبعا كل الانسترومنت لازم يعني يسوي لها removal. هذا هو الكريوتزفيلد-جاكوب disease. عندنا in general we have to discuss the complication or the risk of craniotomy. شنو الريسك اوف craniotomy؟ واحد يحتاج عمليه فتح جمجمه، ايش نحكي وياه وش نقول له وشلون؟ The risks associated with the craniotomy are important to appreciate in discussing operation with the patient and family. نحكي ويا patient, discuss the complication with the patient and the family, and in evaluating patient who deteriorate post-operatively. The figures quoted in bracket will vary significantly between individual procedure and even between centers. تختلف هاي between center إلى center آخر. أول شيء عندنا الانفكشن طبعا 5% and wound breakdown. intracerebral hemorrhage ممكن يصير عندنا seizures، ممكن CSF leak، and ممكن permanent neurological deficit and death occur in 1%. نجي على مصطلح البرين stem death. The brainstem death is defined as irreversible loss of cerebral and brainstem function and is legally equivalent to death. يعني death and a precondition for the harvesting of organ for transplant from the heart beating donors. طبعا هو بهاي الحالة يعني يعتبرون good candidate for transplant to take the organs. شنو diagnostic criteria for brainstem death or the brain death? Identification of the cause of irreversible coma, exclusion of reversible cause of coma, clinical demonstration of the absence of brainstem function. In the United Kingdom, this entails testing twice by 2 clinicians to demonstrate the absence of response to pain. يعني ما عندنا response للpain. respiratory derived يعني apnea despite PCO2 more than 6.7 kilopascal. pupillary light reflex, corneal reflex يكون negative. vestibulo-ocular reflex, oculocephalic and the gag reflex, all the brainstem reflex has been lost or negative in the diagnosis of the brainstem death. يعني هنا يقول the absence of يعني كلهن ما موجودات، ما اكو response للبين، ماكو respiration إذا فصلنا البيشن من الفنتليتر. no pupillary light reflex, no corneal reflex, negative gag, negative oculocephalic, and the negative vestibulo-ocular reflex. Another important subject called compressive neuropathies مثل carpal tunnel syndrome. Carpal tunnel syndrome is a compression neuropathy resulting from entrapment of the median nerve under the flexor retinaculum of the wrist. And the risk factors include diabetes, obesity, thyroid disorder, and acromegaly. The presentation is usually with paresthesia in the hand, whereas at night, and the examination will reveal sensory disturbance in the median nerve distribution. The palmar aspect of the thumb, index, and middle finger, and the radial aspect of the ring finger. The palm itself is relatively spared, reflecting supplied by the palmar cutaneous branch passing superficial to retinaculum. يعني اللي يصير compression بالmedian nerve within the carpal tunnel under the flexor retinaculum, or what is called transverse carpal ligament, and the 3.5 finger disturbed sensation. Wasting of the thinner eminence and weakness of the abductor pollicis brevis may also be apparent. And tapping over the carpal tunnels test or wrist deflection falling test may reproduce symptom. يعني يجي البيشنت who suspected has carpal tunnel syndrome بنسوي له percussion or tapping over the carpal tunnel, will feel the pain, and this is called tunnels test, will be positive, or wrist deflection falling test may reproduce symptom. Nerve conduction study confirmed the diagnosis, and the management include wrist splint, steroid injection, and carpal tunnel decompression by division and release of a flexor retinaculum. Another entrapment syndrome is ulnar nerve entrapment at the elbow. The sensory disturbance affect the little finger and the ulnar aspect of the ring finger. بينما بالميديان كان the first 3 finger and the radial part. هنا عندنا little finger and the ulnar aspect of the ring finger, and the wasting of the hypothenor eminence may be evident. Frohman's sign is elicited by asking the patient to hold a piece of paper in the first web space while the examiner attempts to slide it away. The distal phalanx of the thumb is seen to flex, reflecting the use of the flexor pollicis longus instead of the adductor pollicis اللي هي ulnar nerve innervation. Myalgia parastatica. Myalgia parastatica, the lateral cutaneous nerve of the thigh, is compressed under the inguinal ligament, producing sensory disturbance in the lateral thigh. And thank you. خلصت المحاضرات مالتنا حلوة بسيطة في شيء يعني new in the neurosurgery. فما عندنا بعد أي ثيوري وياكم بالنيوروسيرجري، نبقى بس نتابع الكلينيكال براكتس بالمستشفى، وأي واحد عنده استفسار ممكن يعني هسه يستفسر.